Hello, everybody. Lady Sweet of USA here. Welcome to my YouTube channel. To all my returning subscribers, thank you so much. I appreciate every one of you. Just keep on coming, watch my video, like, share, and leave a comment. And to those who are just strolling on YouTube streets, you come across my channel, do your sister, your friend, your colleague, your aunt, your mom a favor and click the subscription button and subscribe. I have 500 and I believe 19 subscribers right now. Thank you all to all of you that have subscribed. Let's keep on moving. Let's go to 1,000 subscribers, okay? And I sure appreciate you guys helping me grow on YouTube. I also have a Facebook page. If you are strolling on the Facebook streets and you come across my page, or you can just, search for it. You know how you look for street names when you're going to visit somebody? You can search for the streets and the name of my Facebook page. It is called the Big C, aka Cancer and Mental Health Discussion Table. Okay? So, what am I going to talk about today? Let's just talk about mental health generally, mental health. When we talk about mental health, so many people don't really know what it means. Some think, it's to have a disorder, No. We all have mental health, okay? Your mental health might be stable. This one's one might be stable. This one's one might not be stable. We all have mental health. In order for you to be able to function normally, your mental health is intact. Those that are not able to function normally, they have mental health issue. That's the reason why they cannot function, normally. It does not necessarily mean that they are crazy. You can have depression. It's a mental health crisis. You can have anxiety. It's a mental health issue. Somebody that have anxiety cannot function, well, because the anxiety takes the better part of them. So that is why to be mentally sane is very, very important for our day-to-day living, which is a very big problem that we have in Africa, specifically Nigeria. Whenever I talk about mental health or anything, I always relate it to where I'm from, Nigeria. I know in Africa it's rampant, but I can only talk about where I was raised, where I'm from. I was born and raised. The environment that I'm familiar with. Mental health is something that we really don't talk about, in Nigeria. It's overlooked, and when you talk about mental health, they think the person is crazy. When you talk about mental health in Nigeria, they think they think you are mental, like crazy man, crazy woman, crazy boy, crazy girl, somebody that, pretty much live on the streets, dirty, sometimes naked, picking food from the trash, from the dustbin and eating. That's what we consider mental health in Nigeria, But that particular person that is picking food and eating food from the dustbin, being naked, did not just start from there the very first day. It starts gradually because of lack of access to mental health care, and they probably denial as well will make people not to, be mindful of it and take care of it. As a result, it deteriorates, as it keeps deteriorating. If it deteriorates, it will deteriorate to the point that the person take off clothes and being mad on the street. It is very, very, very hard to see uh, people like that in Western world. Reason because they get treatment. They go for care, just as you go to see the doctor when you have a diabetes, when you have high blood pressure, when you have a cholesterol, when you have some form of infection, wound, name it, cancer. Just as you go to the doctor to seek treatment for stuff like that, that is how you should go to the doctor to seek treatment for mental health. However, due to the shame, behind it, due to the stigma, of mental health, loved ones, are very reluctant to seek treatment for their relative who are dealing with mental health. That shouldn't be the case. That should not be the case. People should be able to walk into a psychiatrist's office or a doctor's office that does both medicine and mental health, and tell them, hey, I'm having anxiety. Hey, I'm having some issue with depression, without being afraid to be stigmatized as somebody with a psych problem. You know what I mean? That is one thing I love about Western world, specifically America. They have access to mental health. you know Even your job provide mental health services for you if you choose to use the one from your place of employment. Is I know back in those days they don't really talk about it, but now there's been a lot of awareness about it, that it's a normal thing now. They see it just as you see your oncology doctor. That's how you see your psychiatric doctor. They've moved away from that stigma of not wanting to be associated with somebody that have mental health problem. So many things can make somebody have mental health issues. Even just the way we are raised in Nigeria. you know just the way we are raised in Nigeria can be traumatizing. And trauma, when somebody have trauma, it's a mental health issue that needs to be taken care of. You have to go through therapy, through treatment. Most of the time you really don't have to be on medication. You don't have to be on any kind of psychotropic, but you can go through what, like, therapy. Just go through therapy and you'll be fine. Like psychotherapy. Talk to somebody about it. Because we look down on mental health, we stigmatize it. People find it difficult to seek help. I really, really want us to talk more about access to mental health care in Nigeria, access to mental health care in third world countries, in developing world. That can easily solve most of our problems. When somebody is depressed, depression can lead to so many things. When you're depressed, you either can just console yourself with eating, and as you are eating, you are gaining weight. So you are gaining weight, your self-esteem is just go down the roof, because the society that we live in now glorifies skinniness. When you're skinny, you're seen as being beautiful. When you're fat, when you're overweight, you're seen as somebody that is ugly, and stuff like that does mess up your self-esteem. So it's high time we move away from shaming people with mental health crisis. Anything can set somebody into mental health issues. Let's take for example, I remember when I lost my dad. you know when I lost my dad, that was 2003. you know I almost fell into depression because I was just thinking about him, because of course I was daddy's little girl. Of course, we exchange emails every Monday. He was like my current affair ministers. Me being in America, him being in Nigeria, all the thing going on in Nigeria, like current affair of Nigeria. He pretty much type it in email to me on a weekly basis, and I respond with, what is going on with me over here in America. So just that weekly email exchange that I wasn't able to, I used to look forward to getting his email, and he died on a Sunday. you know not getting that email from him anymore, not able to communicate with him, not able to call him. He was my confidant, not able to call him, to discuss with him, to tell him what is going on, how to go about life. Almost set me into depression. If I didn't have my daughter at the time, my first child was 1 year old, about a year and 6 months when I lost my dad. She was the reason why I did not fall into depression, because I stopped eating. I was emaciated, unkept, you know. And one day, because I was always thinking about him. In fact, as a matter of fact, I was like, I just wanted to die. That was how bad it is, you know. But I didn't want to kill myself, but I just wanted to die. So one day I was just sitting down, just gazing into an empty space like this, and it was just like he was talking to me. He goes, "You have a child to live for. you know of course I know you are sad that I'm gone, but you are an adult now, you are a mother, so I want you to be there for your child. I want you to be there for your daughter. Because if you die today, she's not going to know you. But you know me as your dad." You know? After that conversation, I was just listening. I wasn't saying anything. After, those message echoed into my ears in his own voice. It was like he was just up there talking to me. You know? I had to the only thing that I say was, "Okay, Dad." And just like this, I snap out of it. That doesn't mean that I don't still miss him. I still miss him, but I was glad that I had the opportunity for him to tell me that it's okay, move on, be there for your daughter. And today, even though I still miss him, but I'm glad my mental health is still intact, and I'm been able to have 3 more children and raise my children. You know, every now and then I get sad, especially when it's getting close to his birthday and his anniversary. I get really sad, and all I do, I just go to my emails and I read all those emails that we've exchanged in the past. When I'm reading them, it just puts smiles on my face. Then I just keep on moving. Thank God I have that avenue to relieve my own stress. What if who doesn't have that avenue? Then that person falls into depression and they don't seek treatment. It just from there, it's all hell break loose. You just go down the drain. you know so we need to learn that mental health does not mean that you're crazy. Mental health is the same as, I have a high blood pressure, I have diabetes, I have glaucoma, You know, I have a decayed teeth. You know, so please, let's pay our attention to our mental health. Let's pay attention to our children's mental health, especially those in Western world. You know, because a lot goes on. I know. Anyway, this will be something we'll discuss for another day. Western world parents, children, and mental health. You know, because we tend to don't want to seek help. Which reason? Because back home we treat it as something negative, something bad on you. You know, as a result, we are very hesitant in seeking help for our children. We need to learn to desist from that. You know, we will talk more about that as time goes on. You know, so I'm gonna end this video here. I usually don't like my video to be too long. Maybe the longest about 20 minutes. You know, so that people don't find it too boring. They'll be able to watch it to the end. I shall be back. My schedule has been very busy. I've not been able to upload videos, but I will try my best. Thank you all once more, and God bless. Bye.